Okay, I wanted to talk about healthcare in general, Obamacare, and what I think would be a good idea. First of all, we keep hearing, first of all, I voted for Trump, proud to have done that. But concerning healthcare, I hear everybody, we're going to dismantle Obamacare. Boy, the first thing I do is I'm going to tear that thing apart. Well, that's fine and dandy. To be honest with you, there's some things I like about Obamacare, and there's some things I don't like about Obamacare. And there's one particular thing about Obamacare that I can't stand, and it scares the crap out of me. And that is mandatory enrollment, which no one brings up. But mandatory enrollment, people, do you actually know what that means? When the government says something is mandatory, that means pay up or else. Do you know what the government means when they say or else? That means we're going to take your stuff. And if you don't have any stuff to take, we take you and throw you in jail. You think I'm lying? Believe me, it will happen. Mandatory enrollment equals confiscation of property. If you don't pay your health care premium, at the end of the year, you get a tax bill. If you don't pay that tax bill, the IRS is going to come kick your butt, okay? Now, you folks, and the funny thing is, not one person brings up that issue about Obamacare. You know why? Not the Republicans, not the Democrats. Nobody says a word about mandatory enrollment. You know why? Because they like that part. They all they all like mandatory enrollment. You got to think about this. No one says a peep about that. Mandatory enrollment equals confiscation of property. Okay, now I'm here to tell you this right now. It's already happened with auto insurance. If you get caught with no liability auto insurance, and I know some of you are going, oh, but you got to have that. Everybody's got to have that. Well, there was a time when nobody had that. Everybody insured their own car. The way they've weaseled it now is it's mandatory. I insure your car and you insure my car. How stupid is that? We pay $50 a month. I pay $50 a month to insure your car. In the old days, when you bought insurance, you bought to insure your own car, which is the smart thing to do. I'll be honest with you, how many people out there intentionally go wreck into someone else? The highways are full of cars. Obviously, you're going to have casualties and wrecks on these highways. And there are times when people are absolutely negligent in their driving. And if they hit you, then you know what? You need to sue them, or they need to go to jail for negligent property destruction or negligent homicide, whatever they do. However, if you insure your own car, and if you spend that $50 a month to insure you instead of me, then you get the benefits of your premium that you are paying in. Duh. So what they've got us doing is they've got us hoodwinked into all paying a bunch of money for nothing. We insure the other guy. Every person is insuring everybody else, okay? Instead of insuring themselves. And it's a sneaky little thing. Back to healthcare. Mandatory enrollment is confiscation of property on the way. Count on it, because they're already taking people's cars. If you get caught without liability, they send the tow truck, tow your car, and it costs you by the time it's impounded and sits there 3 days, it's going to cost you $1,000 to get it out. Plus, you have to pay probably $300 fine for not having insurance. Plus, you have to go get insurance. So it's something else, man. That's why these police pounds are full of cars now that they auction off later. They're making a fortune off this crap. All right. So, back to healthcare. Sorry, man, I'm going off on tangents, but this is some serious stuff, people. Wake up. Wake up. All right. Here's what I think we need. We need a single system. First of all, I'm a veteran. I don't care what you people do. I go to the VA hospital, and it's not bad. It's not the greatest, but this place deals with 5,000 people per day. I go to the VA hospital, it's packed, and they are zipping through people left and right, and it's not bad health care. It's not, the Beverly Hills Betty Ford clinic treatment, but it's not bad. I've had several things done, no major surgeries. But when I got out of the Army, they pulled my wisdom teeth. And believe me, that was quite an ordeal. And those dudes, man, they knew what they were doing. And I didn't feel a thing. They did a very good job. Other than that, it's just, blood pressure and all that stuff, Yes, I have high blood pressure, as you can imagine. Anyway, there's my card, okay? Everybody needs a health care card, just like that. We need one healthcare system in the United States. One central healthcare system in the United States. Partly tax subsidized, partly private pay, monthly premium, but one unit, one system for everybody. Veterans, Medicaid, Medicare, private, you name it. One system for everyone. We waste so much time and money on all this myriad of entities that are involved in healthcare trying to get money. And it's ridiculous. Now, under Obamacare, man, that healthcare.gov signing up, my wife, we're doing it with her. It's hours and hours. And when you run into a snag with the insurance companies, you get on the phone, it's a hassle. It is such a hassle. Not to mention, under this health plan that my wife has just now re-upped for, it's HMO, so she has to have a doctor from the network. And you can only get a doctor in your zip code. There is one doctor in our zip code that she can get. There's tons of there's a few pediatricians, nurse practitioners, but the choices are, I think there's like 4 choices, if that. I'll have to go back and look. There's very few choices in our zip code. But my wife wanted a female doctor, in case she gets a female examination. My wife don't like no man touching her except for me, okay? So she wants a female doctor. There's not one available. There's one guy, one doctor is her choice in this stupid Obamacare insanity and HMO insurance company game playing insanity. Whereas just 5 miles away in another zip code, there's several female doctors. And my wife would like a female doctor. Golly, is that so much to ask? There is so much insanity in our healthcare system. First of all, hundreds of billions and billions of dollars in taxation, hundreds of billions of dollars in premiums, and most of it goes to pork fraud and waste. Not enough money actually goes to the healthcare. Our system is too inefficient. It is not streamlined. It is a bureaucratic nightmare. Pardon me, I just burped. Our system was insane before Obamacare. It is insane under Obamacare, along with dictatorial little rules thrown in, like mandatory enrollment. That mandatory enrollment, let me tell you, and listen up, it's not good because the government has the power. A better system would be no pay, no play. If you don't pay in, you don't get to see the doctor unless you fork out cash. Everybody goes, oh no, what are you going to do for emergency? Well, obviously, if you're in a damn car wreck, you get to go to the emergency room. I'm talking these regular doctor visits. People do blood pressure, you know, all this sort of thing where you need to see the doctor. They got the flu, whatever, that sort of thing. If you are not enrolled in this system, then you pay cash to see the doctor. Or you pay up all your back premiums that you owe. So if you go 2 years without enrolling and you want to see the doctor, they're going to look you up and they're going to say, sorry, you haven't been in the system for 2 years. You owe us, you know, a couple of $1,000 and you can see the doctor and you can get enrolled in the system. Otherwise, pay cash for your doctor visit, which will be $400. So what we need is one central system right smack dab in the middle of America. Where'd that flag go? There it is. Right in the middle of America. One system right there. A big old building with like 20,000 employees, and it doesn't have to be government run. It can be a private company, but I would want some government oversight. This central agency would collect all the premiums and it would distribute payments for said premiums. And every person enrolled would be issued this ID card, which would contain all your payment history and whatever. It will let them know, you know today computer, that you swipe this card, there's all kinds of information they can get on there. So we all get one card. I'm talking veterans too. The only thing is, and everybody the premium needs to be between $50 and $100 a month per person, maybe 20 for kids. We need this. It's supposed to be affordable. You know, there's people paying $800 a month. Are you kidding me? That's a house payment. What are you talking about? I think I've known some people that told me the wife and husband are paying $2,000 a month. What is this nonsense? Are y'all crazy? We need an affordable, Affordable Health Care Act. What the hell is affordable in that for? Because for most people, it's not affordable. Now, people who do qualify for the Obama subsidy makes it somewhat, well, pretty much affordable, sort of. You know, it is. It's affordable. But, you know, the service, it's kind of, you know, like I say, you can't get a female doctor. You got one choice for a doctor in this nonsense. So here's what I think would be a good idea. One system, one place in the middle of America, all the money goes to, all the taxation, all the dollars for healthcare goes to one system in the middle. And I'm talking VA, Medicare, Medicaid, private, all of it. The taxes, the premiums, everything goes to this entity. This entity also pays out the money. Every person enrolled gets an ID card. If they don't pay their premiums, they owe the premiums to see the doctor. We spend trillions in this country, and we are taxed. Don't think that you don't pay for health coverage. Everybody pays taxes towards health coverage, okay? So don't think we have to pay these $500 a month premiums. We're already paying taxation in a healthcare system. The problem is there's too much damn pork, fraud, and waste in our healthcare system. And yes, I believe the lawsuits are going a little too crazy too. So that's my take on it. Okay. Obviously, there's more to it than that. It's very simplified, and I'm just a simple man. But you know what? I've heard better ideas from average Joe Americans so many times above what I hear from these politicians. These politicians come up with the dumbest crap most of the time. They really do. Everything they come up with seems very inefficient, doesn't make sense, and it's always loaded down with time consuming, inefficient nonsense. I really don't get it. But it's probably because they really don't give a damn. Thanks for listening.